Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
How much do you trust this WHO report as to the source of this pandemic?
Well, you know, this what you're hearing today has already been reported a couple weeks ago, the preliminary report. And it makes the most sense. It makes the most sense genetically, and just how these diseases evolve and jump into humans, like HIV and other ones. It's the most plausible theory. We may never actually really know exactly where it came from, but this virus is very similar to the one they found in the bats, the pangolins, and also it's very closely related to SARS and MERS, the other coronaviruses. So, it makes sense to me. And this whole thing about it jumped out of a laboratory is, way down the list. It's like less than 1% chance at the best.
So a couple of weeks ago, Texas notably dropped their mask policy, and now it looks like the COVID numbers are way down about 17 days later. They're vaccinating a lot of people, but that, I think, causes people to think, well, should we be wearing the mask? What is your reaction to that?
No, I mean, that's a good question. The Texas numbers are down, but the United States numbers are up. Most states are reporting an average of 7% increase. Look at the statistics just from Illinois. It's not going in the right direction. So you've got to be careful. I mean, there's 50 states and 6 territories with the U.S. citizens in it. Are you just going to pick the one state that happens to be doing good? Now, why would Texas be doing good? I don't know, but there's possibilities. One is maybe they don't have as much of the variant as we do. We now have maybe 50% of the B117 variant here. So that's one thing. Texas may not have that. I don't know. I don't know if they even test for it down there. Who knows? Also Texas is a lot warmer. It's a southern state. Now, they had their snowstorm last month. But they could be outside more. Maybe that's I don't know. I don't know what the story is. But
Florida doing well, Dr. Murphy, or is Florida trending upward with spring break?
Florida trending upwards.
Yeah.
Yeah. Florida's trying. I mean, look what they just went through. Spring break. I mean, if you're going to get this virus to transmit, you behave like that.
Yeah.
All right, let's get to some viewer questions. This person says, has there been any further research into why some people are asymptomatic and others are severely ill? Any genetic links?
Yeah, this is the question of the hour. Whoever answers this question is going to get a Nobel Prize. We don't know. It's probably a combination of things, like usual. Countries that have a lot of older people with underlying risk factors. Perhaps it is genetic. We know there's a difference in blood types, how many people get it. Some places, the social distancing and mitigation work. There's a whole bunch of reasons of why there's different levels. The mitigation part actually affects the inoculum, the amount of virus that a person gets infected with. If they get a lot, maybe they get sicker. I mean, there's so many different reasons, but we haven't figured out exactly what is the best answer for that.
Okay, next question. Can you get first dose in Illinois and second dose in another state?
Well, if you can get the vaccine, that's fine. The vaccine is the same. The United States government bought all these hundreds of millions of doses from Moderna, Pfizer, Johnson & Johnson, and others. They already bought them. It's all coming from the same source. It is the same vaccine. If you get Moderna here, you're going to get Moderna in Wisconsin, Indiana, Florida, or wherever. So, but the thing is, can you get it in the other state? Because a lot of these states now are restricting people vaccine access to their residents.
All right, next question. My wife and I have received the COVID vaccine. Do we need to quarantine from our kids if we get exposed to the virus at work?
Yeah, this is a good question. So this was a part of the change in the CDC recommendations just a couple weeks ago, and they're saying that if you're fully vaccinated and you're 2 weeks out after that second dose, that you don't have to quarantine.
All right. If you have a question for the doctor, you can post it on our Morning News Facebook page. We will talk to him again tomorrow at this time. Have a good day, doctor.
Thanks, doctor.